to give some tips about how to get involved with the legislative process as a nurse. There's a ton of ways to get involved, and here's just a few easy ways that you can. So the first one is know what the issues are. The most important thing that you're voting on is a person, because most laws are not voted on at the mass level. It's not like the complete democratic process. We vote a representative and then they vote on legislation. That person is really important. You need to know when you're voting for a person, not just if there's an R or a D or an I or a G or whatever behind their name. You need to know how at least they say they're going to vote, or how they voted in the past on things that are important to you. And as a nurse, legislation that affects healthcare policy and nursing practice is important. We need to know. Another great way to be involved, most states have an annual state legislative days, and you can go as a nurse, learn about policies, meet your representatives. There's different workshops. Usually, like hospitals that I worked at, they sponsored nurses, like pay for them to go. And I haven't been myself, but I've talked to some people that have, and they come back all energized and pumped up, and they've talked to people in the legislature, and they give their input. And face it, most of our politicians are politicians. Maybe they're lawyers, businessmen. Most of them are not, or have not been, nurses or doctors or allied health or anything. So they really don't have much experience, personal experience with healthcare, other than as a consumer of healthcare. Nurses know what's going on in the bedside, and they could give a lot of input. Another great way to be involved is to write letters to the editor about healthcare policies. Don't just stop at letters to the editor. Those are good. That's a good place to start. But you can actually, okay, so I'm going to let you in on a little secret. People in the media, reporters, especially local reporters, they're going to go with an easy story most of the time. If you have something that's interesting, current, and you've written it and you have sources, you've done their job for them that day. Okay, you may or may not get a byline. The most important thing is that that information is going to get out. People still read newspapers, and since media has shifted to the online format, there is a constant need of new content. And so your article that you might write, your little, blurb, they're going to accept it and put it out there. It's free content for them, and it's a way for us to get our message out there. Another tip I have is get on Twitter. Twitter is a great way to get into contact with real people in the government. They want to know what we think. Another tip is join your professional organization, and there's a ton of them. Don't limit yourself to just one. Of course, do always join your specialty organization. For me, that's A1. A1 actually has an emerging nurse leader program that they do every year since 2007, and I'll have a link in the doobly-doo, which is the description of this video, and it'll have some links in there for the different places I'm talking about. But A1 has this emerging leader program. They mentor nurses throughout the year. They give them education about leadership and legislation and different various things. And then they go and meet in Washington, D.C., and they talk to congressmen and women, and they learn about policies and how things work. And it's a great program. Another really great resource for learning about current legislation that is important at this time is nursingworld.org, and that's the American Nurse Association website. I go there a lot to see, kind of get what's going on in the United States. For me, I'm an advanced practice nurse. I'm a clinical nurse specialist, and it's important for me to stay up to date on what's going on in my profession. I received my graduate degree in another state, So in that university, I went to the same core classes as all the other APRNs. So like I had nurse practitioner students, midwife students, nurse anesthetist students, and clinical nurse specialist students. They were all in the same core classes, and that's where we learned about pharmacology and assessment, like physical assessment and diagnosing and differential diagnosis and all those things. We learned those together, and then we branched off into our own specialties, and mine was adult health. So fast forward to moving to Texas and trying to get prescriptive authority, although they will honor, like if I had graduated as a nurse practitioner from the same courses, I would have prescriptive authority today. But since I went to the clinical nurse specialist route, those courses are not honored. And so I have to jump through additional hoops in order to get prescriptive authority. I'd have to retake those courses here, spend thousands of dollars in 6 months, and a lot of clinical hours retaking those courses. And that's not an option right now. So it's not just prescribing medicine. I can't practice to my full scope. I can't consult on a patient and order them anything, like a lab test, home health. I can't order a breast pump for a patient. I can't do anything other than what a registered nurse can do. But I can be licensed as an advanced practice nurse. So that prohibits me from practicing to my full scope, but also it prohibits me from taking care of the patient population that I trained to take care of. And I spent hundreds of hours learning how to care for a population, and I can't. So changing how advanced practice nurses practice in the state of Texas is very important to me. So my last tip is celebrate wins no matter where they are. Whenever I see a state doing the right thing, maybe they're granting independent practice to advanced practice nurses, or they're adjusting staffing levels to be, line up with current practice, or whatever they're doing that's good, I blast it on my media because I want everybody around to know what we're doing and what they're doing, and it gets awareness about the issues that are out there. So unless we celebrate the wins to raise awareness, we're not going to get our message out. So it's really important. Celebrate your wins. Even if they're not your wins, they're still wins for nursing. So celebrate. So thanks for joining me for this week's tip, and I will see you next week.